Hi, very good morning, Pharm D friends. Hope you're having a good time. Last week I had a seminar discussion with some Pharm D students and just sharing my experience and giving you some tips on research based on my experience with them there. First of all, the project or the research should not be just limited to the fifth Form D, where as a part of the curriculum they do some project work and they submit it as a part of their requirement by PCA or by the university. I think the process of research or asking questions, research is nothing but a question that is unanswered, or a part of the question that is not answered, a smaller part of a bigger question that is not answered, or a question for which there is no answer in a particular region like Tamil Nadu or India, whereas a study has been done in Europe or in some other country in Asia. That can also be a research question. But only thing is, the research question should be uh, of the answer of that research question should be of some use to the doctor or to the patient. Otherwise, there is no fun in doing a research or asking that question. So, like we were sharing about some small tips, like with second year, third year, I am not exposed to the study design, the protocol, the pro forma, the ethics committee. I don't understand what's all these things. No, there is nothing big in all that. If we follow the truthful part, the sincere part of answering a question, I think it all falls under ethics. We should not do anything wrong which we feel is unethical or it is not good for any human being, which I cannot do, I should not ask anyone else to do. So that's the basic logic behind it, and the research question should follow the principle of SMART, SMART, specific, measurable, achievable, relevant or reliable, and it should be time bound within a particular time. So you can start research or working on projects from second year, third year, fourth year, so that the moment you get out of Form D in the sixth year, you'll be having five, six publications where you would have done from the least to the best possible evidence. Like the today the medicine is based on evidence. It's called evidence based medicine, where you start with a case study, a case series, and then a case control study, then something like a cohort, something it goes like a systematic review, an observational study, a descriptive study. Then you go for an experimental study. Then finally you do a clinical trial, RCT or something in your fifth years by getting proper ethics committee approval and putting it in the C-Try website of the ICMR and all those things. You will be able to get an experience of 6 months to 1 year when you finish your Form D and get out. So, like, you will be at par with someone who has worked for 5 to 6 months in the industry, where if you go with some three or four publications or five or six publications from the least possible evidences to the best possible evidences, it's very simple. Frame a question. When you practice in the hospital, you will get to know some questions, right? It can be very simple, it can be very silly. Just take a professor or someone else's help as a guide and try to frame a question. Find out the aim and objectives or under that question, what all can be found out, right? And then do a literature review, like what all has happened in the last 5 6 years. Put them in an order. Not don't go more than beyond the 5 years, because it becomes relevant irrelevant when we go beyond 5 years. Well, the last 5 years it has developed, so you need to take it beyond that level. So do this literature survey, and please don't fix up. Okay, I need a study with 500 number of patients. I need to do 20 number of literature reviews. Don't go with all this humbug of fixing up numbers in research. There is no particular number. If you have a question and you need an answer and you have a doubt and you need to find out how can you do that study and what will be relevant to the patient or to the doctor, all those things have to be done. So there is nothing like you need to have 15 literature surveys. I see some teachers themselves are asking 15 literature review has to be put, one literature review in one slide has to be put, two literature review in two slides have. Please don't fix up the numbers. The question is about the quality of the data, the quality of the study, right? So follow the instinct of doing the right things rather than fixing it up for numbers. The study need not be too big. See, you cannot do a research in a preterm baby with 1,000 babies. Can you do that? And the pregnancy related complications, you want to do 5,000 numbers. All these are irrelevant, and all these will become, it will not fix under the SMART, specific, measurable, achievable, relevant, and time bound. That's very important. So once you have done this, you have an introduction, you have an aim and objectives, and then you will have to find out how am I going to proceed with the study, right? So what, when, who, how, where, why, all these questions have to be answered. So that's what is the methodology all about, research methodology. How am I going to find out the answers? What is the procedure? What is my instrument? Instrument means not necessarily a lever, it's like a crowbar, or it's like a spatula or something. No, instrument is something which helps you to achieve your research objectives. Like, it can be a questionnaire. A questionnaire is also an instrument. A bank check is an instrument. So that's the basic understanding. Methodology is the most important part of the thing. The idea is the research question, the aim and objectives, the methodology part, and the results and discussions and the conclusions has to be in line with it should be in the same line. That's what is the idea of research. So once we will complete the methodology, clear the ethical committee approval by submitting the relevant papers, the instruments, the translations, everything to be done. Please don't even ask the name of a patient without getting a consent of the patient, right? This is basic sincerity and ethics towards handling people, which we should not try to get out of, because as a doctor of pharmacy student, we are in the process of delivering customized healthcare to the patient, and in which we should not deviate from the ethical part of it. So that's the most important thing. Take a proper guide, frame the questions, get into the methodology part of it. What is the study design? Understand it. If you are completely convinced with what you are doing, I think you will not be doing a project or a research. You will be enjoying what you are doing, because you are going to add value to the medical knowledge or the scientific knowledge that is present, and it will add value to the doctors or to the patients. Otherwise, please don't do that research for the sake of doing that research, and don't think it should be done only in the fifth year as a part of the curriculum, right? As a pharmacist, it's your basic job and responsibility to understand and ask questions and find out more answers for the questions that are not done. That itself is research. So this itself will give you enough opportunity to get into the fields of, say, pharmacovigilance, clinical trials, or whatsoever. Like, you are going to be in the profession after 1 or 2 years. So don't just stick to only the curriculum part of it. Get out of it. Do more amount of research from second year. It can be a smaller research. It can be a systematic analysis. It can be a simple question. It can be a letters to the editor. It can be anything. It can be your opinion. It can be a case study which can be communicated to a journal. With, if it is going to be different, what you understand is going to be different. It can be a comment. It can be anything, right? So please go attend seminars, attend workshops, present papers, join oral presentations, get exposed yourselves to various things, and start doing this so-called projects. I would not say project, so-called researchers from the second or third year. If you have a question when you practice in the hospital, best wishes. Thank you.